Cool. All right. Hey, folks, this is just tagging on to something that I don't know if you heard a presentation by one of the students. Bilal is his name. Uh, and I guess he created and left out for your consumption several pamphlets, which I took with me to see what he had, and he had some good stuff there. All of it is on oral health and oral hygiene. And so I thought I'd expand a little bit on that today. Uh, and it wasn't hard to find two individuals that are older, brushing their teeth and following good hygiene practices. Um, you know, and none of them appear to have any problems brushing, but of course, a snapshot like that is staged. Yeah, I wonder how many individuals really like to brush their teeth. When I was a kid, I hated brushing my teeth. As an adult, it's like an absolute must. If I forget it and I plop into bed, sorry, got to get out of bed, brush and floss. Do it, do it, do it, do it. It's like putting shoes on, socks on, clothes on. Got to get it done. So, all right. The basics are seen in this little picture over here to the left, or at least to my left. Toothbrush, toothpaste, and floss. Those are all the basics. So, all right, we know a lot more, and a lot more could be said about oral health and our ancestors. Um, and one could write books, and one has written books on that topic. Uh, the Romans actually were pretty advanced in the way they handled their own oral care. And Egyptians, they had practices, but they were not quite as advanced. But they go back even further as far as the people. Um, One thing that I found interesting is it wasn't really uncommon for uh, these individuals centuries and thousands of years ago to have trouble with excessive wear. And it was because of, well, what they were eating and how they were eating it. Um, Oftentimes, like the Egyptians, like it or not, sand, grit, small hard objects, stones, whatever you want to call them, wound up in their meal, wound up in whatever they were eating. And so after a while, it tends to wear your teeth down. Like grinding without, worried about grinding your teeth at night if you have problems with bruxism. But that was one little thing I thought, oh yeah, I guess they would have had sand in their food, probably more often than they wanted. It wasn't uncommon either as far as issues go for them to have lesions, infections. Tooth decay was also something that apparently was quite normal, um, and which made me think they must have had quite a bit of pain. And it'd be interesting to see if any ancient doctor wrote about the way they treated dental problems back in those days. Diet was, again, I mentioned diet, the sand, the grit, very hard, woody like food staples too, which, the I'll show you in a minute a guy chewing on a stick. Uh, Very crude way of cleaning your teeth. Um, it's not that they didn't know how to take care of their teeth. It was just they weren't very sophisticated about it, and they didn't do it as often, apparently. And class distinctions may have played a part. That's way back then. Luckily, we've come much, you know, further ahead than our ancestors about, well, knowledge about how our teeth, um, how they grow, blood supply, the enamel, the pulp, everything else, how to fix problems in the jaw, et cetera, et cetera. So we've come a long way in treating teeth and gum disease. So here's a picture, not very appetizing if you're getting ready to eat, but this this is a picture of a jaw, ancient jaw, several thousand years old. And the holes that you see here in this picture are actually places where cavities had started. And the teeth were rotting. And as you can see, there were a couple of teeth that may or may not have fallen out due to, being rotten, or just came out, after they were dead and buried. Hard to tell. But looking at these, I could see a lot of holes in areas where the teeth look pretty darn flat. And I imagine that's also from wear and tear. So what kinds of challenges do we face as we get older, especially? Well, problems in the mouth, in the oral cavity, are not too different than problems happening in the rest of the body as we age. The jaw changes shape sometimes. For lack of a better way of putting it, whatever you practiced or did when you were younger tends to catch up with you. And then, things like smoking, drinking coffee, wine, alcohol, your otherwise general health as you get older. But like everything else, it suffers from age as well. If the body suffers from wear and tear over time, so does the oral cavity. And things like blood supply, nerves, roots in the teeth, they undergo changes, and usually not for the better. So, with age comes disease. I mean, at least the risk of more disease processes. And I want to say that is after about 60, 65, problems in the mouth tend to start mounting. Whether it's trouble with the tooth enamel or the gums around the teeth, or a person's jaws, their jaws, etc. The small glands that make saliva, we tend to make less as we get older, and we suffer from dry mouth, and also a good case of halitosis. I think xerostomia is the name of the word for an extremely dry mouth, or not enough saliva produced over time. So here you can see the top 10 senior problems: arthritis, osteoporosis, dental made it there somewhere. And unfortunately, this picture, it looked larger when I looked at it yesterday or the day before. Now it looks awfully small, but dental problems, they do fit pretty prominently. And there was a statistic in here that during the 1950s, nearly half the adult population was wearing some sort of denture, partial or complete. About nearly half the population had some sort of version of that. And today it's down to around 18%. And this quote's around 20% wear dentures. And so there's a lot of good that comes with that, but there are a lot of responsibilities also that come with wearing dentures. And some of that also is related to the shape of the mouth and how that might change, and some unique problems if you don't take care of your false teeth. So, and as a nurse, I can tell you I have seen my fair share of everything in the mouth. Open up, give me a smile so I can look at the tongue and the oral cavity, one tooth. And everything else is gone. Or they pull both upper and lower out. And then I get a good look at the gums and everything underneath. Or smokers, coffee drinkers, maybe they're doing something else that stains their teeth. Maybe they're chewing on something that stains their teeth. I get a good look at that. It's like, ooh, okay. So that and different kinds of odors from their breath. So, yeah, not that I miss that very much. I really don't. But Yeah, some things just stay in your head after you experience them, you know? So, these are the top 10, which they're all pretty relevant. They're all pretty relevant. Now here's something I had to direct quote from, and this came out of, well, where did this, out of the NIH, and it's this article, Oral Health, Disability, Physical Function, et cetera, et cetera. Markers of poor oral health, particularly dry mouth, poor rated oral health, or presence of one or more oral health problems were associated with some kind of disability, poor physical function in older populations. Now, it says more studies need to be done, more investigations, and these associations and underlying pathways are needed. But, it has been correlated that, problems with gums, teeth, infection here, have the capability of moving through the bloodstream to the heart, especially the endocardium, and could be, and probably is the root of a lot of endocarditis problems. And incidentally, we try to emphasize oral care in the hospital. If any of you have been to the hospital and had a surgery, within the last, I don't know, 5 to 10 years, they do recommend you brush and do your oral hygiene before you come in early in the morning. Then once you get there, they put you through it again, and an oral rinse to gargle and wash everything out, along with all the other preparations, so that when they're intubating you, they have less of a chance of introducing something from your oral cavity into your lungs. Because believe it or not, there's millions of bacteria all over your teeth and gums. So it's not very, it's kind of like, I don't stay awake at night thinking about that, but that's concerning. That's why we brush and take care of our teeth.
I never knew that.
Well, hopefully you won't hold on to that statistic for too long.
Is that healthy bacteria? I mean,
Yeah.
Well, here's the thing about healthy and unhealthy bacteria. There is healthy bacteria, and it actually is part of starting the digestion process along with saliva. So when we use oral rinses that contain, alcohol or chlorhexidine, and there's a couple of others that are on the tip of my tongue, but I can't spit them out. No pun intended with that one, but that actually kill the good along with the bad. It's like anything antibiotic, it is going to kill good with the bad. So, however, it makes sense to me that before the doctor starts fiddling around with the tube going through into my mouth and down my throat and into my, windpipe, that I have kept that area nice and clean and clear. But there are other diseases or illnesses, I should say, associated with problems in the mouth. It's startling to think, but and I could go on, and I'm not, because I need to finish this presentation. I could go on about ventilator-acquired pneumonia, because that's also a problem. So here we go, a more primitive way of dealing with our teeth, and it makes me think of a picture of Huckleberry Finn with something sticking out of his, or, something from the time of the Civil War. They're chewing on something like a big long toothpick, as if, maybe they're doing that to loosen something they ate from around their teeth, which kind of makes sense. But this is a funny picture, nature's toothbrush.
How important is flossing, Rob?
Well, getting the right size of floss is probably a good idea. That won't fit between your teeth.
I still struggle with flossing.
Yeah, flossing is no fun for me because my teeth are kind of squished together. Really need some sort of corrective thing. I really need some sort of corrective measures, but
Like a retainer.
Yeah, I'm just, well, as long as I get a clean bill of health and I have no cavities, no, gum disease, I'm good. I'm good for now. Anyway.
Brush your teeth.
Yeah, just brush my teeth. Whoopsie. All right. Here's some fun facts. I don't know. Maybe they're not very fun, but they won't make you smile. Oh, well, a little bit of humor there. Didn't go very far. But our oral cavity is home to more than 1 billion bacteria. Woohoo! Yay! Billions of bacteria. It's also home to hundreds of species of bacteria, both good and bad. Some beneficial, some very harmful. The harmful in the sense that they form plaque eventually. And anything that you eat, like oranges or something else, that can leave an acidic film in your mouth can start the tooth decay process. So oranges are great, but this is where you have to start keeping track of brushing and at least rinsing, maybe chewing gum, something like that, to keep saliva going, because saliva will keep that cleaned off. So, yeah. So poor brushing can allow a lot of bacteria to remain and grow. And I want to say, even on a single tooth, you can count a lot of bacteria. Now, halitosis, very bad breath, is a common condition, and it's usually due to diet, poor health in general, maybe, and poor oral health, tooth decay, something else going on, infection. And again, hearkening back to that idea that poor oral health can lead to other conditions. I found a lot of information on that. I found a lot of information through the CDC, through the NIH, through the New England Journal of Medicine, British journals. Oh my goodness. They're all, noticing that connection. It's there. It's there. So that's why we try to, push this when someone's even in the hospital. Clean those teeth, clean the oral cavity best you can.
I would say too, because it's like, I didn't know like, what's called teeth that are actual bones. Yeah, I guess it's one too.
Right. Well, there's something alive underneath those teeth. There's a root in there underneath. There's the inside of the tooth as well as the outside. And, for dental care, you see, there's a whole lot of things that can happen. Heart disease being one of them. It can lead to stroke eventually, by way of inflammation and formation of clots. Lung conditions, if for some reason you swallow material with bacteria on it down into your lungs, we call it aspiration, pneumonia, that's definitely a problem. Dental decay, as we saw in that ancient lower jawbone, all the holes in those teeth, that is tooth decay. So bad breath, well, that comes from lack of, keeping up with good oral care. Tooth loss, well, yeah. Going back to that one gentleman who opened his mouth because I wanted to look in his mouth to assess it, and he had one tooth that was up here and it was toward the front. One tooth. Crazy. Gum disease is rampant. And that's another reason why nurses get in there and look, looking for swelling, redness, bleeding, pus, that kind of thing. Now, diabetes makes it really tough on someone who's got oral problems, cavity problems. Usually it has to do with healing, blood vessels, and nerve endings. So if you're diabetic, it's a must to take care of the teeth. Now, nobody thinks much about oral cancer. And here's something too, if you don't get your mouth checked somewhat often by the dentist or a doctor, you might have something developing back there. And in fact, the numbers are growing after the age of 60, individuals developing some kind of mouth cancer, whether they smoke or not. So it's kind of a scary thing. So, all right, this is from the CDC. All right, 3 conditions most affect our overall health. Because I'm trying to tie oral health into our overall health. Decay, cavities, severe gum disease, tooth loss. Because unless you get something done about that, you have a gap there that's wide open for an infection. Now, I know what it is everybody knows what it is to feel pain in the mouth, but, things that you eat, things that we eat, our diet has a direct effect on what's going on in our mouth too. If it's all carbohydrates, especially the non-complex type, or it could be certain fruits and complex carbohydrates, it will start that cavity process, and if you're not keeping up on it, it's bad news. I know I'm being repetitive here, but you have to consider we have to consider what we eat, how we eat, and then how oral problems affect our jaw, maybe how we speak, what we can eat, because if it's hard and we've got problems with teeth, you have to shift to something softer in order to get it down. Or what if your teeth are just sensitive to cold beverages? Now you have to modify things. And so and if you're missing teeth, it also changes your bite. So that's another consideration.
How do you feel about apples?
Oh, I like
I mean,
apples.
That's slogan.
I like apples.
The doctor, an apple a day keeps the doctor away.
How do you like them apples? Right. So here's where this might apply to us as we age, is economic status, because we already know economic status goes across the board as being a problem and maybe a predictor of oral hygiene, poor oral hygiene, or good oral hygiene. And economically, some people can't afford even the basics of a checkup, maybe a set of x-rays, maybe getting their teeth cleaned and at least examined by somebody, a dentist, even if you don't have the money for the work. So economic status too will come into play with everything else above that as far as oral procedures are concerned. If you don't have the money or the coverage, that's a big problem. That's a big problem. Now, I already mentioned tobacco and diabetes. They're a problem all over the body, unfortunately, but they factor very important up in the oral cavity. So now, I mentioned before sensitivity, sensitive teeth, gum disease, impacted teeth, things you don't want to think about. Oh, I don't want to think about that. Oh, I hate the dentist. Well, you'll hate the dentist until you have to go see them, and then they say, why did you wait so long? Even though you have the money and the coverage, why did you wait so long? Oh, because I have a phobia. Well, get over your phobia so you don't end up with an abscess or worse. And so here we also have problems. If inflammation gets too bad in the tooth, it will affect the pulp inside or cause tooth decay from the outside to the inside. It can also cause dental problems, infections, because when you think about it, our sinuses are very close to the oral cavity. You got an infection here, it's not a very long walk to get up into your nasal cavities. And from there into the brain too. Abscesses are a big deal. Cracked teeth. I remember having a cracked tooth, and who was I seeing? He was going to do a root canal, and he said, "I can't do a root canal on this. The sucker's cracked. You need to go get it pulled." I said, "Oh, no." No, I wasn't happy about it. I was not laughing about it, but I just thought, how come I'm looking in the mirror at this thing? I didn't notice the crack. Well, anyways, so it's a factor. So consequences, we just went over a bunch of them. Endocarditis being one of them. That's an inflammatory response to infection in the musculature of the heart, inside musculature. Infections can go all over the place. They don't stop at the heart of the lungs. They can go to other major organs, organ systems as well, the brain. Saliva is very important. Now, I have a problem with that. I have chronic dry mouth, like I have chronic dry eye, and I use a CPAP. And I have trouble with my mouth just drifting open at night, and it dries out. So I have to use a Biotine rinse on it as often as I can, or chew gum as often as possible to stimulate saliva or to replace it. And that's to help replace the pH balance within the mouth. Too acidic, you start breaking the tooth down. Oh, here's a lovely little presentation here. We have the nice tooth going on here on the left side, at least as I'm looking at it. But let's say you have inability to maintain optimal oral hygiene. Well, you got microbes, because every tooth is covered with billions of microbes, millions of microbes. Well, it has a chance to have its way, all right? From there, it has a risk to move, transient bacterial infection, and move to the heart. Now, this could start at a very young age, or people who are, I want to say, prone to or have some sort of immunological problem are very much in risk of disease of the heart, simply because of poor tooth hygiene or poor oral hygiene. So this is a vicious cycle that, kind of moves around and around, but I think it proves the point about why good oral care and good oral hygiene is good for the rest of the body. And not just for the mouth. Good for the mouth. I want to smile, open up, and talk every now and again. And yeah, my teeth are stained, but at least they're healthy. I got to see the dentist tomorrow, by the way. So this is so appropriate. This is so appropriate. I see the dentist tomorrow. Here I am talking about oral hygiene. All right. So can we turn all this around? Yeah, I think we can. We can turn some of it around. Diet is a good place to start. Get rid of those Snicker bars. Replace them with apples, bananas, vegetables. Yeah, I know. I love a payday bar every now and again. It's a vice, but tastes so good. I just have to brush. So, if you have the proper texture of foods that your mouth can tolerate, not too sensitive, or it doesn't hurt. If it hurts when you're chewing, or if you've got sensitive teeth, you've got a problem, which needs to be investigated at the dentist. Or who's the specialist that deals in root canals again? Is that orthodont? Not orthodontist. Periodontist?
I think so.
Good Lord. Yeah, you may be right. I right now my brain is kind of like, so I would say it's at least rinse your mouth regularly, brush your teeth at least 2 to 3 times a day, soft bristles to medium bristles recommended. Got to be consistent with that. When I was a kid, I hated it. That's why I was always in the dentist, fidgeting in the chair, giving the dentist a hard time. I was always saying, stop fidgeting, stop moving. I didn't want to be in the chair. So floss at least once a day, maybe twice a day. Toothpicks work really good. I know that some of those individual flossers have a pick on the other side of them. Those are really good. Here's some of the oral rinses. Some have fluoride, that's recommended. Others have kind of an antiseptic effect, so they have alcohol in it, or they have like Cepacol is another one that has a not Cepacol, Cepacol maybe. That also has a substance in which I have a lot of trouble. It's too long for me to pronounce, but it also is used for bad breath as well as killing germs. Chlorhexidine that's the big guy in the room. It kills a lot of bacteria in the mouth. Also stains your teeth. So if you use it regularly, it turns your teeth green. I learned that the hard way. I won't tell that story. So these are things that you can use to help keep that keep your oral hygiene good, consistent, and well, free of yeast, free of bacteria, or I want to say, I don't know, free of cancer. Now that's a different situation because I imagine that would have more to do with your immune system and problems immunologically. Anyway, so elements of good hygiene, again, 5 steps. Brush your teeth, eat better, drink lots of fluids, liquids, not soda pop, water. Visit your dentist, even if you have a phobia. Recently the dentist will sometimes take blood pressure when you're there. Usually my blood pressure is high when I'm in the dentist office. And it's ever since I was a kid, I hated it. And it's kind of one of those psychological things. So my blood pressure is usually a little higher. It's kind of like white coat syndrome in a way. So floss, and change your toothbrush about every 3 months. That's typically what I do, about every 2 to 3. So David says every year. I had a friend who looked like he changed his toothbrush probably once a year. And the bristles on that toothbrush were flat as like a hurricane came and blew them all down. And I didn't want to ask him about that, but he actually he poured his toothpaste over it and went at it. I said, I didn't want to say there's no bristle.
He was for his flat teeth.
But I think that was so funny since you mentioned it, David.
Really? 3 months, I don't think I've ever,
Oh,
actually, I just,
well, that's good. Bristles is a good thing.
you tried the one motorized ones?
Yes, in fact, I use one now that is
So fast, so, but it also
Yes.
takes away the enamel.
Yes.
It can't do
I
that.
only use it once a day.
Okay, you know what I'm talking about. And you gotta be
Yes.
careful of accidentally biting down on it, because it'll chatter the teeth.
Yeah, I'm very careful with it. I use it once a day, and it's worked out well so far. But I have several refill pieces for it. So
I have a question.
yeah,
If I may.
go ahead.
My dentist will give me prescription for amoxicillin. Anytime I go see him.
Ah,
my
yes.
Fingers in my mouth, he said that I have to take 4 of those at one time. Now, that's kind of strange.
If you've ever had endocarditis,
Right,
the amoxicillin makes complete sense. Absolutely.
have to do it anytime they're sticking their fingers in my mouth.
You got it.
Yeah.
Because, I mean,
Prevention for the bacteria or,
yes, it's to help mitigate. So you get it probably before,
right,
and you'll
Well-
take it I don't know how many doses
1 dose,
just 1 dose?
4 pills.
Okay, so you'll take that in and around the time prescribed
Right.
for your oral dental procedure.
Right,
And that will usually stop in its tracks possibility that you're going to get bacteria traveling to your heart.
Okay, they only did that after my stent was put in.
Well, they need to continue
Oh,
doing that.
Anytime they're sticking their finger in my mouth. now,
Yes.
they come off this.
Yes,
2 hours before.
I agree.
Okay, so it's not just bullshit.
No, it's not BS, trust me. Oh, boy.
So, something to worry about.
Absolutely, absolutely. When I used to go in for deep cleaning, and I still do, in fact, I'm probably up for another deep cleaning. They have me rinse my mouth with chlorhexidine prior to that
That's the green
procedure.
stuff that.
Yeah, that's stuff that turns your, it just looks green when you pour it into a cup
Right,
too.
It does. How about hydrogen peroxide? I mean,
Nah, I used to use peroxide. My dentist said, don't do it anymore.
Because it
Kills,
also-
kills away too much flora.
bacteria.
Yeah.
Yeah,
She says, yeah, I understand your reason why you want to do that, but you don't want to kill all the good with, a lot of the
and it kills
bad.
everything.
Yeah,
It makes the teeth white. It helps make it
yeah.
whiter.
I used to use the peroxide strips,
Okay,
but they kind of hurt my mouth.
yeah, after a
So-
while, it eats the enamel.
Yeah, and so, yeah,
Don't do it. Yeah.
yeah,
My toothbrush, I ain't changing.
I agree. I agree.
Don't do it.
So for those of you who are out there and practice good dental hygiene, WebMD says it's recommended about twice a year to go in and see your dentist and get examined. Maybe get your teeth cleaned, maybe get some x-rays. However, you gotta know it's not a one size fits all kind of thing. Some people can actually, they're very good about keeping up with their dental health or oral health, and they may not need to go in quite as often. I don't know too many people like that. But other things factor into this too, like lifestyle, your attitude, your own, makeup, biology, access, affordability, as far as dental care and coverage goes. So a lot of things affect, they may say, you need to do this. Well, my coverage only does this. Well, can you pay out of pocket? How much is this out of pocket? And then you get sticker shock. And so it's not a one size fits all kind of thing, which is good. So, all right, we already know regular teeth brushing. Linda says it's good to be redundant.
Oh, no, it's important.
So, we can reverse some of this, poor oral hygiene. In one of my public health rotations as, going from an RN to a bachelor's in nursing was to kids. And we were at a school, small little middle school called Jonas Salk here in town. We were handing out, if they answered questions, we handed out everything you could think of, little water bottles, little compact Kleenex, dental floss, little miniature toothpaste. Yeah, with toothbrush, just to get them thinking that they could answer questions, etc. Little incentive. Kids like free things thrown at them.
Cereal.
They want to pipe up. Most of them are like, oh, I know the answer to that anyway. Okay, well, I'll give you and you both, since you both were at the same time. So we can do something about this. There are also some other things too that you might want to include in your diet. Phosphorus is one of them, vitamin D and calcium, since D and calcium go better for absorption purposes, building stronger bones, assisting in also creating and maintaining healthier teeth. Staying away from a lot of goods that are processed. God, if we've preached anything in this, if we've preached anything here in cardiovascular wellness, it's staying away from processed foods. Well, here I am at it again. I'm chipping away at that and pounding away. Processed foods out the door. If you haven't started smoking or drinking, please don't start smoking or drinking. Red wine will stain your teeth. Smoking will stain your teeth and will cause recession of your gums, destruction of blood vessels, which will eventually lead to destruction of nerves, like diabetes. That's sort of certain same process. So again, smoking also supports bacterial growth.
floss, basically.
Mhm.
I think I never knew how important honestly flossing was until it's like especially with the water flossing, it's like with those now coming in handy. So it's like, I mean,
Yeah, I'll tell you. I know. Oh, your battery's low. Am I not plugged in? Oh, no.
I think it's oh,
I think it's plugged. Unplugged. Am I not plugged?
it's unplugged.
Oh, no. Okay. We're back in power here. All right.
Question, Ron.
Yeah.
I once heard that you produce vitamin B12 in your mouth at night.
Yeah.
And that if you were to wake up in the morning and rinse your mouth with water and swallow it, then you can get your vitamin B12 for the day. Is that true?
You know, I've heard of that. I've heard of it. That's why I kind of, bristled my ears or made I don't know. I've heard of that. Now, how much truth there is to it, I don't know. I haven't examined it from a vitamin standpoint. And I took nutrition. I took basic and advanced nutrition. You'd think I'd know more about that, but I do know that some people can't absorb vitamin B12, and that becomes a problem. They have to get their vitamin B12
There.
here, and I'm one of those because my celiac and irritable bowel don't allow me to process vitamins and certain, nutrients that we count on for repair and growth. I have trouble with absorption. So, but yeah, there may be some truth to that. I need to look into that. Yeah, you can take it orally under the tongue.
Near middle, I'm up there, and I was, you could see it in my gait and everything. And after I start taking this one that you let it melt in your mouth, it was like night and day. And so you have to take the pill, or you have to get it through the food or whatever, not any absorption. I mean, I don't know what
Well,
your diets are.
if your diet requires supplements of things like mag and calcium or vitamin D, within reason, it's okay and it's good to do that, especially if you have malabsorption, illness of some sort, or you don't have access to good food. I want to say food that actually has a high nutrition value. Then you may have to rely a little bit more on a supplement. Unfortunate, but true. So all of this in the recap is what I just covered. This incidentally for the sleep apnea thing, I do have to stay on top of using the biotin at night. It's not uncommon for me to wake up in the middle of the night and my mouth is dry as a bone. I thought, well, that's not doing my dental work any good. So it poses an interesting issue for people with apnea, and how if they have trouble also producing saliva. So steps, okay, here's some more steps. I like this picture simply because it had smiley face on the toothpaste and the tooth is holding the toothbrush, So I liked it. And I just said, I got to have this in the presentation. Just got to have it. So I'm just going to end with this. Here's the best foods for your teeth and your tooth health. Here are some of the worst foods for your tooth and gum health. And I wish that was bigger. It looked bigger, like I said, when I brought it up on my screen. I said, this would be great to have in the slideshow. And there's a contrast here between what's shown on the right, or at least from my perspective, to what's shown on the left. And it does matter the source. It does matter the source. So with that, I'm just going to go ahead and end this. Any questions? Concerns? This is a huge emphasis, I will say one last time. This is a huge emphasis in the hospital. Huge. There is initiative about preventing pneumonia. It had to do with oral care. It's still ongoing. But part of the Healthy People 2020 was an initiative also to bring that care in the hospital to longer term care. I want to say homes and places where care is also done. Extend that initiative to give proper, consistent oral care to individuals, clients there as part of the Healthy People 2020 initiative. Well, we have Healthy People 2024. I don't know what that initiative is right off the top of my head, but this book's kind of dated. It's probably a 7th edition of this one out already. But anyways, so any questions, concerns, issues? Anything you learned, anything new, anything old? How did you like my picture of the ancient jawbone? Anything you want to add? No, we're good? Well, I think at this point then, thanks for being here if you're out there in Zoom land. And we're going to go ahead and stop the recording and end this session.